Everyone knows aging sucks. What's really unfortunate is that it seems to happen all at once during perimenopause and menopause, and in this video, you're gonna understand why that is. Hi everyone, I'm Dr. Amir Karam, board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode of Skin School, we're gonna talk about menopause, and we're gonna talk about how menopause affects the skin as well as your overall shape, and why so many women during premenopause and menopause find themselves at a loss of why everything is changing so quickly, so rapidly. We're gonna understand the science behind it and give some ideas about what you can expect and what things you can potentially do to address this. All right, folks, you're gonna find this very interesting if you're in that late 40s and early 50s, or if you're younger and just wanna know what's coming up. This will give you a lot of insight and a lot of tools that will help you be more prepared for the process that's happening and happens to every woman naturally. All right, so let's break it down. Have you ever wondered why that late 40s, early 50s period, there's a complete change in the overall status of the face, and it happens so suddenly? Your 20s, your 30s, and most of your 40s, you pretty much look like the same person. But take a person and go through the late 40s and early 50s, they're transitioning, and by the time they're in their 60s, sometimes you look at a photograph and they don't even look like the same person that they did in their 30s anymore. And when you really ask the person, you know, what's bothering them, and say, well, you know what? I don't look as young as I feel anymore. And I'm seeing this stuff happen very quickly. The correlation for women specifically, and this has nothing to do with men because men don't go through menopause or perimenopause, is that there is a change in the overall hormonal status, specifically estrogen, that seems to initiate an entire cascade of events that have negative impact on the skin and the facial fascia. And they're two different things, and I'm gonna discuss this separately in a moment. But if you think about it, this is what it comes down to. There's some biological anthropology theories that try to explain this. The entire purpose of any species, of any animal, is reproductive success. And what does that mean? That means that you are an animal of any species, humans being one of them, is put on this earth, is born basically to pass on their genes. Right? There's a period of fertility for a woman that lasts from, early teenage years all the way through perimenopause and menopause, called late 40s, early 50s. Those are the reproductive period of a woman's life. And during that period, there is a certain set of physical manifestations that you want to refer to them as youth and beauty, that are thought to assist in the reproductive journey of a woman. Right? Skin looks supple, it's clear, there's no discolorations, there's no lines and wrinkles, there's fullness in the volume. And then when you approach this period where reproduction ends, all of a sudden, skin starts to change, it becomes discolored, lines and wrinkles, thinning, the face starts to sag, jawline and neck, and you start to become older looking. And you say, well, that's not fair because I've got a lot of years ahead of me. Why is that happening? Well, believe it or not, life expectancy was in the 30s and 40s. It wasn't until the advent of penicillin that suddenly life expectancy rose to the numbers that there are now. Now, of course, like healthy living, good food, interventions for the heart, interventions for cancer, etc., is allowing human beings to live a lot longer. So we're witnessing a greater number of our species, ourselves, getting through post-menopause, post-reproductive years, and watching the physical manifestations of that happening as we age. So while we're around, the idea is that you should be, in a place where you can reproduce, so that the body says, all right, where I'm putting in a lot of metabolic energy, a lot of energy to maintain a certain appearance, and then after that point, the body just says, whatever. That's just a theory, and it's a biological anthropologic theory based on evolutionary kind of ideas, etc. But take it for what it is, and agree or disagree. It doesn't change the fact that perimenopause and menopause are correlated directly with these physical manifestations of aging and the onset of aging. And when you look at it from a biological point of view, from a hormonal point of view, there's one hormone that seems to be sharply and very directly correlated with the aging process, and that is estrogen. When you look at estrogen on a growth curve, you see that at mid-20s, the number is cited as 27, there's a peak in estrogen. And then there's a slow drop in the level of estrogen, sort of a slow decline. And then there's a rapid loss of estrogen production in our late 40s and early 50s, correlating again with perimenopause and menopause. We see this also with people who have surgical oophorectomies, where they take out their ovaries for a variety of different reasons. They have early onset perimenopausal and menopausal changes. And these are changes that I've seen in my own patients who had that surgery and they're in their 30s and early 40s or whatever, and they all of a sudden have all the physical manifestations of somebody who's much older and seeing the aging process turn on as a result of that surgery, which is kind of an interesting correlation, but it also is another kernel of truth or reality that these things are tied together. When you look at it a little bit deeper, you see that estrogen also follows the collagen curve. Estrogen and collagen seem to correlate together. When you transpose these two curves, you see they're following the same general trajectory. So collagen is peaking in the 20s, then diminishes as time goes on, and then it takes a sharp drop in those years. So what happens to skin collagen, and you should know this as a foundational sort of point, is that skin collagen is what gives skin that fullness. And when you get to a certain point, when collagen production is decreasing, the structure of the skin starts to thin. And when skin starts to thin, the dermis starts to thin, well, guess what? The skin starts to involute, meaning it starts to fold on itself. It starts to become crepey, becomes filled with lines and wrinkles. And another thing that seems to correlate during this entire period is also pigmentation seems to become accelerated during this period of time as well. It's almost like the skin, cells, the melanocytes that create pigment, the fibroblasts and keratinocytes that produce collagen and elastin, they all kind of like, okay, we're retiring. We're not gonna produce as much as we did before. And our indicator for that is estrogen. So what happens is, as the fibroblasts and keratinocytes decrease their production of collagen and elastin, skin thins, melanocytes, which produce pigment, melanin, increase. So the net effect of skin is skin that looks thinner, crepier, lined and wrinkled, and you see more pigmentation. There's also things that are happening to the moisture content of the skin and the skin barrier, which skin becomes more dry. Skin becomes, you can call it like less hydrated looking, therefore less supple looking. And those changes further the kind of like wilting effect of the skin and preventing the skin from having that supple, dewy look that young skin has. As a result of those changes, ultimately skin starts to stop producing that cell turnover process, and the top surface of the skin starts to become thicker, making the skin feel rough and making the skin visibly less bright and translucent. Dullness, roughness, lines and wrinkles, dryness, discoloration is the definition of skin aging. So we know that these things are correlating. Now, when it comes to the shape of the face, you get the fascial layer, which the fascia, by the way, is what holds the face up. Right? It's the deep structure of the face. That starts to loosen, elongate, and cause the face to take a different shape. That means jowling happens, laxity of the neck, hanging of the midface, drooping of the corners of the brow. That's all happening. Now that's a separate change than what's happening to the actual skin. That's happening at the level of the fascia, and it's really, really important for you to understand those two. And there's a lot of videos that I've produced on this channel that talk about how you can address the changes of the fascia, talking about the surgical procedures, the different types of approaches, and also the different types of techniques at home and in the office that can improve and help skin. But we're gonna delve in even a little bit deeper and try to put a little bit of perspective around this so that when you watch those videos or when you go and hear about different ideas about this, you'll have a very, very good perspective on what makes sense based on this knowledge that you're accumulating right now and how to approach it. When we talk about fibroblasts and keratinocytes, the two main cells of the dermis stopping their activity, or slowing down their activity, I should say, and therefore decreasing the production of collagen and elastin, all those really important components of good, healthy, young-looking skin. Well, there's a workaround that. So what is the workaround? The workaround is product ingredients like retinol, for example. like vitamin C, like niacinamide, certain peptides. What they are doing is they are bypassing the fact that biologically and genetically you're decreasing the production of collagen. They're getting in there and they're turning on the DNA that makes collagen and elastin start up again. This is the beauty of active anti-aging ingredients like the ones I mentioned, the retinols and the vitamin C's, niacinamides and peptides. What they're doing is they're making the cell come out of retirement, basically. It's saying, hey, stop being so lazy, turn on those factories, let's start building. So what you see when you're on these particular products is the dermis starts to thicken again, cell turnover starts to happen again, more elastin starts to occur, fine lines and wrinkles decrease, but you also are making an impact on the production of melanin at the level of the melanocyte by decreasing their production. Especially when you use those products in addition to some botanical-based pigment reducers, what you're doing is you're working at the cellular level. So you're taking the fact that estrogen has caused collagen to decrease, and you're bypassing that and you're saying, start building up more collagen. It's a beautiful thing. That's why over the last 4 or 5 decades, we have grown to know and love these particular ingredients as being kind of the foundation of skin anti-aging. You don't have an anti-aging skincare regimen if you're not on these products. And if you're not on these products, well, you can assure that your skin's gonna continue to diminish over time. So those aspects, and I urge you to watch some of these videos that I've created on these particular individual products. I think they're gonna give you a lot of insight on how they work and the value of them, some of the mistakes that people make, etc. But at the end of the day, that's the workaround. So let's talk about dryness for a second. There's a couple things that affect dryness of the skin. One is transepidermal water loss, right? The water that is being evaporated through the skin. If you have an intact and very healthy skin barrier, you're withholding, basically preventing skin water from evaporating. Therefore, the skin is gonna appear more moist and supple and all that. Now, if on the other hand, as you age, the skin barrier function starts to diminish, you're just losing water, right? The other thing is at the core of the skin, hyaluronic acid, which is ubiquitous throughout our tissues in our body, hyaluronic acid functions like a sponge, taking water and hanging onto it like a sponge. And as a result of that, keeping skin looking more hydrated and more supple. So what ends up happening is, as you're aging, you're decreasing the hyaluronic acid content of the skin, and therefore the skin becomes more kind of wilted looking, in addition to losing more of its water. The combination leaves the skin looking more dry. When you're thinking about this, think specific ingredients, right? So when you've heard of hyaluronic acid serums and hyaluronic acid products, what they're doing is allowing hyaluronic acid to enter the skin externally and then draw water and bring moisture back to the skin and creating a more hydrated look to the skin, which is a very positive impact. When you think about barrier protection, like for example, you saw that video that I made on Enrich, which is a barrier balm that we created to basically retain moisture in the skin. What that is doing is it's keeping the skin from losing the water content of the skin through evaporation, and as a result, therefore looking more supple and more hydrated. Now, active ingredients should be used daily, consistently over time, because just like diet and exercise, you need to keep that machinery flowing so you get the collagen to build on itself, because you know biologically the default is to slow everything down and you're gonna go back to baseline. That's not what you want if you really want to defy skin aging. The question then becomes, well, what about lasers? What about microneedling? What about the things that it can be done in the office? Now I'm gonna say this, when it comes to skin and collagen production, any injury that happens to the surface of the skin, even if it's a minor injury, and when I say injury, I'm talking about like how your skin interprets injury. So microneedling is a form of injury, chemical peel is a form of injury, laser is a form of injury. All of these things are creating basically something at the surface of the skin that signals the skin, hey, I need to heal, I need to repair. And if you send that signal down to the level of the fibroblasts again, well, guess what the response is gonna be? Production of collagen, because how do you heal something? You heal by producing collagen. So that's an amazing little workaround, right? So do those type of treatments Again, frequently enough to where you're gonna get change. But the reality is, how frequently can you do a laser? How frequently can you do a chemical peel? How frequently can you do microneedling? You can't do it that frequently. A, it's expensive. B, you're gonna be like physically in a state of downtime too often. So think of those as like enhancers. Think of those as like boosters of the collagen production that you're gonna get based on the active ingredients that you're putting on your skin on a daily basis, okay? But they do have a place and they do have a value and they do definitely help. What should you not expect from your skincare or your lasers or those type of things? Well, number one, don't expect your jawline and neck to start to lift up again. Because again, as I mentioned earlier, this is one of the biggest points of disappointment for people who are going through this. They think, oh, these two things are tied together. My skin and my fascia are the same thing. They're not actually. The fact that your skin is sagging is only because your fascia is sagging. Think about this for a second. When you get pregnant or when you gain weight or lose weight, what does your skin do? It follows the deep tissue, right? Stomach gets big during weight gain and pregnancy, and then when you lose it, it starts to shrink back down again. The skin follows. So as the fascia gets longer, the skin simply follows, but it's not the reason why your face is falling. It's not because of the skin, is what I'm trying to say. The laxity aspect, the fascia laxity aspect, is a surgical problem. And I've done quite a few videos on that, and I want you to, again, review those. But the fascia laxity aspect should not be something that you expect lasers, microneedling, skincare to improve. Just know this. But the quality and beauty of your skin can definitely be something that you can address no matter what, whether you're during menopause, after menopause, or any point. These things are like bypasses to the whole process. What about hormone replacement therapy? Now, hormone replacement therapy comes in a variety of different types, and I don't want to get into in depth about it, but there are hormone replacement therapies that obviously have estrogen in them, they have progesterone in them, there's a number of different things. So what ends up happening is, sure, if you're taking estrogen, you're gonna slow down this process. No doubt about it, it's gonna happen. But you can't stay on those things necessarily forever. There's a period of time where it's not healthy to be on it for a variety of different cancer risks, etc., just overall kind of like body physiology. So there's a period of time that you can do this, and then there's a period that you have to go without it. So during that period of time, definitely the impact of external estrogen being taken orally is going to have a positive impact in terms of slowing down the collagen loss phases. But eventually it's going to happen. Plus you're on a negative trajectory anyway. So all these things should be part of your strategy well before menopause happens. Like if you're thinking, I want to prevent skin aging from really manifesting, then starting in your 30s and 40s, you should be doing these things to really kind of like improve your skin, go this direction as opposed to going this direction. Go this way. Menopause happens, obviously wants to drop a little bit, but you're starting at a higher point is basically the idea. And you can really kind of like diminish a lot of this stuff from the exaggerated effects. So people in their 70s, trust me when I say this, I've had so many patients in their 70s have amazing looking skin because they've been doing this stuff that I'm kind of describing, the stuff that we describe in some of these other videos, their whole life. So that's really, really good news, that your skin is in your control regardless of what's happening with menopause or perimenopause. Very, very important point to highlight there. The sagging aspect, unfortunately, not a lot you can do. Your lifestyle doesn't have a huge impact on it. Obviously, like stress, sleep, all these things, diet, all this stuff has an impact, but it's not like you can have the perfect sleep, the perfect diet, the perfect, healthy lifestyle and never age. Like that's just not gonna happen. Your body, you can do that, but not necessarily your face. So just separate some of these things. The laxity aspects and the skin aspects are two separate things. One, you're gonna need a surgeon like me for. The other one, you're just gonna need to be smart about your approach and the products and the commitment that it takes to achieve them. And what's fascinating about this concept that I'm describing, this feeling, is transcendent across every culture that I've ever come across. I was a double major at UCSD. One of them was biological anthropology, so studied a lot of this stuff well before I even thought I was gonna be a facial plastic surgeon, which was interesting. They were teaching anthropology of aging, cultural anthropology, all these different things. And fascinating that every culture in the world views aging in the same way. It's not an ideal state to be in. Whether it's Asian cultures, Middle Eastern cultures, South American cultures, European cultures, there is an active approach, whether it's talked about as often as we talk about it here in the States. It is definitely a reality that people care and want to defy the aging process. I've had patients from Denmark and Belgium and places like that where it's kind of taboo to have these surgeries. So what do? They just come here and have it and don't tell anyone they had it. But bottom line is, it's viewed in the same way. People struggle with it the same way. And there's an understanding that you should have, that it's not about like being weak or feeling vain or having vanity. The reality is, you don't look familiar to yourself anymore. If you close your eyes and you think about how old you are, regardless of how old you are, you have a picture of yourself in your 30s. I know this only because every single patient and person I've ever asked has always stated that is their state of mind. And then they look in a mirror and look in a photograph and they're like, wait a minute, I don't look that young anymore. And who is this person? And you stop wanting to take photos and you stop wanting to, whatever. Like, it just becomes this thing that is on top of your mind. So you're not alone if you feel this way. And I can understand and sympathize and even empathize with you that this process of physical aging is real. So don't feel alone, don't feel bad about this. On contrast to men, a lot of people say, oh, it's not fair, men age, like fine wine, whatever. It's not totally true. We have so many men who come in wanting to have these surgeries done, are all over their skin. They really want to address it for the exact same reasons that women do. The only difference is there doesn't seem to be a point in time that correlates with onset and change. Maybe it's more gradual, maybe it's like, it happens a little bit later. It happens at variable periods of time. I mean, there's men that I've operated on who are in their 40s and the men I've operated on their 60s that say like the same thing. In the last few years, this has all changed. But the physical changes that are happening to skin and fascia, skin and shape, are equal to men and women. Even though it might not happen right away, it's gonna happen. You can count on that with any guy. And the final sort of piece to this, just putting things into perspective, this doesn't have anything directly to do with genetics, other than the fact that there are genetic factors that seem to make people age a little bit younger and a little bit older. Like, we have a number of patients who are, lax and things like that starting in their 30s. That's kind of like premature aging genetics. Then there's a person who just literally is hanging on and they're in like their late 50s, early 60s. Very rare as well, but both extremes are rare. The bell-shaped curve is right there for women, right there in the late 40s, early 50s. Again, the number one age that I operate on, and the number one age that people get really focused on the physical changes of their face. Skin is like gradually changing as time goes on, and then really takes a speed, accelerated period during this time. I hope this gives some perspective around the menopausal, impact and what you can actually do about it. I hope you take this as, hey, there's good news. You can do a lot for your skin. And really, frankly, this is totally the reason why I developed the trifecta, is to be able to make that part really, really, really easy, to do the right things from an anti-aging point of view, and understand that where the different tools along the way, these, you hear about from a marketing point of view, where they fit into this sort of this story, so you don't end up doing too many things prematurely or unnecessarily to address one thing or another when it's not going to necessarily work. And once again, folks, I hope you enjoyed this video. If you haven't already, make sure you follow so you can get videos like this more often. Make sure you like this video if you enjoyed it. And if you have any questions, drop them in the comments. And of course, as always, please share them with some friends and family. If you love content like this, make sure you subscribe to the Karam MD Journal, where I talk about skin and facial rejuvenation topics, and it comes to your email every single week. It's a pleasure always to share educational material with you all. As always, thank you so much, Dr. Amir Karam.